Kathy and Jamie are back. Good morning.
Good morning, Mr. Chair, Commissioners. You all received the handout for this week with our COVID updates. And as you see, the cases continue across the state of Minnesota and in Clay County. So there's no decline yet, obviously, in those cases. And we have an additional death in Clay County, so we're at 91. Unfortunately, lost another individual to COVID. And then there's a few additional deaths across the state of Minnesota from 7,079 to 7,163. So we're seeing some additional deaths. Active cases did decline since last week. So we were at 190 and we're at 167 this week. So, I mean, that's positive, but again, it fluctuates, obviously. We have hospitalizations and people in ICU. I talked with Minnesota Department of Health, and what they're seeing currently is the hospitals are managing okay, but we're seeing increase in cases for school-age children now. So, and unfortunately, some younger individuals are being hospitalized, and those in ICU. I know there was, for example, a 40-year-old with no comorbidity, so they had no underlying health conditions, and obviously, that's not a very old age, and they were on a vent. So we're seeing some of the unfortunate cases where people aren't at the high-risk category and yet getting very ill from COVID. Our 14-day case rate went down a little bit, so that's also promising for Clay County. It was 64 last week, so now it's 51.43. So that's going down a bit as well. So you see the graph at the bottom is just the cases per week. So we just graph that out. And again, we're seeing a decline in that. The next page is our cases by zip code. And so Commissioner Mojo had asked about that last week. And then we just added a column for whether they increased from last week or not. So you can see that there's some increase in cases in Moorhead specifically, some in Dilworth, and a few in Sabin, but some of the other areas we did not see an increase in those cases. The active ages, cases by age, so we see that there's high numbers in the 10 to 14, and just as a reminder, we have no vaccine for those under 16 yet. The Pfizer is the one that we can use for 16 and older. So we don't have any vaccine for the younger groups. We still have high numbers in the 20 to 24 and the 30 to 34, and then actually the 35 to 39 as well. So anywhere from the school age to like the 40 is, again, what they're seeing across the nation and across Minnesota. And then the cumulative cases by age are at the lower graph. And again, the highest one is the 20 to 24 age range. The hospitalizations per week are listed in a graph. There was, I think, just 10 additional hospitalizations when we checked last week for our hospitals in Fargo. Again, a manageable amount, but the concern is, again, younger ages being hospitalized. And then across Minnesota, they were increasing, but they're staying stable as far as hospitalizations in ICU. We're not seeing, again, the large increases that we had previously. And then we go into the testing, the vault testing site. And so we got our last week, April 25th is our last week that of the testing activity. Not the last week for vault testing. They're going to continue. We haven't heard an end date of when they might ramp down, but we see a little bit less of the number of tests conducted in the week of April 25th, 893, but still a fair amount of testing being done. Positivity rate is 5.18. But the testing site still continues at that vault testing.
Kathy, are you hearing much about this, the availability of at-home test kits now? I think they're on the market.
Haven't heard that, but they are available free through the Minnesota Department of Health. So, but no, haven't heard that.
Do you have them, at Public Health?
Yes.
And
So,
those?
no, I'm
No,
sorry, you have to
not-
order them from the State Health Department.
Okay.
So you can, and that information is on the county website, and also the Minnesota Department of Health website, so you can have that delivered directly to you.
Okay. I do know that they're available in some retail places too.
Didn't-
I think there's other testing going on locally
Sure.
too, besides these places, so.
Sure.
Kathy, I think Commissioner Mojo had some questions for you before we get into the vaccine.
Oh, absolutely.
Thank you, Commissioner Campbell. Just pivoting a little bit, Kathy, to another issue in your wheelhouse. There have been reports nationally and statewide about the increase in detox overdoses, usages. Fentanyl overdoses are up 27% in Minnesota alone. Can you talk a little bit about what you've seen trending with our own detox center and what you're hearing from the officers in the field?
Yes, we did receive the health alert from the Minnesota Department of Health about such a large increase in the opioid deaths in Minnesota. So from even 2019 to 2020, a 59% increase. That's pretty significant. And we are one of the detoxes across the state of Minnesota who serve all individuals. Some detoxes will serve alcohol only. Some do not want to take all of the multiple
They don't
drugs.
serve alcohol,
They don't serve alcohol.
Okay. Just wanted to
Yes, I'm
clarify
sorry.
the
Thanks for
record.
clarifying. Yes, that wouldn't be good, would it? They serve the clients who have alcohol, high levels of alcohol, but they will not serve clients with opioids or meth, some other drugs that are being seen. And we're seeing a lot as we go through this, the increase from alcohol to multiple drugs, and oftentimes it's multiple drugs. We're seeing an increase over the years of that. So the benefit we have in Clay County is we're serving all of those individuals. We're also serving pregnant women who are having chemical use issues with drugs and alcohol, and some other detoxes across the state would not serve pregnant women. So it's unfortunate because we need a location to serve all of these. So we're definitely seeing high numbers. We're also seeing the acuity level of these clients is pretty high. So when you have a detox we have a medical oversight, and then we have nurses on every shift and medications to help them through the detox process. And so it's really important when you think about where are these individuals going to go, and the number of increases that we're seeing nationwide and across Minnesota is pretty alarming. And so we are, it benefits our whole community. We met with our previous medical provider passed away, and so we have a new provider from Sanford who just last week came to our facility. He wanted to see view the facility for himself, and then talk about our programming. And he expressed the high need. He worked in some other states where there was no place for individuals that were overdosing or needing to detox. And so he really sees this as a huge benefit for our community. We have a detox in Fargo. They have a detox in Fargo, but it's not the same level of care. They do not have medical oversight. They don't have nurses. There's a need for those, but that's a lower level of acuity because of the demand with all of the effects of these drugs. It's really a high level. So he expressed he really likes the fact that we have a detox in our community, that can serve the metro area and then others across the state of Minnesota. He did say how much it saves on ER visits. Otherwise, where are you going to bring people? To the emergency departments? And potentially they tie up a bed for a few hours as you're trying to determine where they can be placed. And so he really sees this as a benefit. Obviously, we have a small facility, and so we express the hope that we would be able to increase the bed capacity in maybe another location in order to serve a greater population in our community. The problem isn't going away, so we see this as a, he really expressed, and this is the first time he had been to our detox. Obviously, he took over from the previous medical director, so he was very impressed with what we're doing, the fact that we have a new license, withdrawal management license, and so we'll have more capability to generate some revenue from that.
Well, and thank you very much for answering that and giving, I think, our audience a broad understanding of the services provided. I think from this perspective, it's really important to see how COVID has affected our community as a whole. And that's not necessarily just with the data that we receive weekly. I think COVID has strained families and individuals in ways that none of us can really know. And it's heartbreaking to see these increases. I think, we've had discussions as a county board on how to help keep our community and county safe and healthy going forward as we move out of the pandemic. And I'm deeply concerned that we'll have some residual effects in this area in particular moving forward, so thank you.
Yeah, and Mr. Chair and Commissioner Mojo, we, not to be amiss, that although they're, it's chemical use that brings them into our detox, there's so much underlying mental health issues as well that go along with that. So we're really seeing the, comorbidity of that.
Thank you.
Well, Commissioner Mojo, thank you for bringing that up, and we have been having some dialogue on that, and we were able to do an awful lot with our CARES dollars that were received, and unfortunately, I don't think we were able to accomplish enough with the detox portion of it, although it still had, it makes it significantly harder for you to do your job in your confined space. So I think as we move forward, and I do want to point out that Commissioner Ebinger and I are serving on another task issue with Across the River, and I did raise the question to them about detox and maybe looking into the future of partnering on something, and there was some real excitement on the part of the Cass County Commission members that were at that meeting. So I think we'll be looking at that together to see if we can. I think when you look at some of our smaller counties, the Wilkin counties, Monoman counties, Norman counties, they don't have a facility, and I think for us to be able to tackle this from a regional approach might be a really good option for us. So that dialogue has just started. So just so you're aware of it, and I don't know if Commissioner Ebinger wants to add to that, but we'll be working on that.
Great.
Yes, just one more step, and it is really critical that we look at this regionally. But that's when we get our greatest successes, is when we approach it as part of the community, not just across the river, but east of us in some of those counties too. All of them have expressed a need for medical detox. I'm part of a group that's looking at some of the issues that have impacted on the homeless shelter here. Pastor Sue put together a group of us, including the chief of police. One of the issues that is foremost is some of the limited psychiatric beds won't take somebody who's intoxicated. And there's the other issue I see, which has been happening for years, and we have not addressed it, but there is the Oxycontin addiction has now led to fentanyl being manufactured offshore to look like Oxy, and it's being sold, and even if they're not intentionally disregarding the amount within each pill, it's a sloppy operation. Some of them are gonna have 3 times the amount they planned on it, and some of them very little. And that's where the overdoses are coming from. And that's where the increase in addiction is coming from, on the opioids. And meth has been a problem in the Red River Valley for years. So this is something I think its time has come, and we need to do something about it. I think we can. And again, that's something we want to look to the future on here pretty quick. But thanks for your efforts on this.
And thank you.
All right. Amy, you want to talk about vaccines?
Okay, we'll talk a little bit about the vaccine data for Clay County in Minnesota. In Clay County, people with at least one vaccine dose were at 39.4%, and people who have completed the vaccine series is at 32.9%. And again, we have the age breakdown of the number of individuals vaccinated. So we didn't make a lot of progress in that 16, 17-year-olds, but there are slowly an increase in the number that we have. And then 18 to 49 is at 8,175. And then the 50 to 64, 4,896. And then the 65 plus is 6,123. So total of 19,475. And then people 50 and over with at least one dose, we've got 48% for the 50 to 64-year-olds and 74.7 for the 65 and over. And then we've got the Minnesota data. We've got larger copies so I can see them, so hopefully you can see them as well this week. And so the statewide number of people with one dose is at 58.6. People have completed the series, 45%, and then you've got the breakdown. I won't run through that, but for the 50 plus with at least one vaccine, we're at 63.1 for Minnesota for 50 to 64-year-olds, and 60 plus is 87.2% statewide. And then we have the breakdown by zip code again, and shows the percentage by zip code of individuals who have received the vaccine. I'll give you a minute to look at that. And then we'll go on to the Clay County Public Health vaccine that's been administered. The total doses administered for Clay County Public Health alone, we are at 13,750. And this past week, it was 391 doses, so things have slowed down significantly. We are seeing more of the second doses that we're administering than first doses. And then also the timing is perfect for that. So we are no longer able to use the students. The nursing students are finished. So I want to take a minute to thank NDSU, MSUM, and M-State for all of the hours and that the students and staff have put into vaccinating the community. And we've got the data from Cass County that we've put in there as a comparison for Cass County and North Dakota at the bottom of that grid. And another thing that Kathy brought along with you, or for you, is just some myths. Our public information staff have been focusing their energy on hesitancy, vaccine hesitancy, and trying to encourage people that they continue to need to be vaccinated. And so she shared some myths and facts, and these are also posted on our website and have been shared with all the county employees. The public information staff talked yesterday that they received a lot of positive feedback from the staff when this was shared with them as well.
And let me just add, Mr. Chair, that initially this was sent out to all of the faith communities. So Commissioner Cayley had brought up some concerns about what's being discussed out there as far as facts and myths. So we did send this out to all of our churches in Clay County, as well as the chamber and other various organizations. And then, again, like Jamie said, on our website. So hoping to get, because it's interesting, you know, we get kind of over and over. There's one in here about that the vaccine alters the DNA of an individual. We hear that a lot. Truly a myth. There's no way possible biologically it can affect your DNA. So there's just some interesting myths and then the facts in there as well. I know there's individuals that have shared it with family members who believe some of the myths. So it's really great information. And like Jamie said, getting lots of feedback from people that have received this about, you know, making sure that we have the facts versus so many myths that are out there.
Commissioner Gross.
I got a question on Clay County. I mean, I look at our percentage of people who've taken it. You know, is that because, I mean, we're pretty low, I think. I look at 39% and 32% with one vaccine or with two. Is that because we don't have it available, or is that just people not doing it, you know?
It is available, but we do believe that not all of the data is getting to Minnesota. So anyone who goes to a pharmacy on the North Dakota side, we don't get that data. So if you're a Clay County resident and you went to a pharmacy on the North Dakota side, we don't have that data. And then also anyone who went through the Veteran Service Office, or the data does not go into the Minnesota immunization system. So yes, we do believe.
I could
it's
visualize
low.
that could be a high number, okay. So,
Thank you.
But right now, it doesn't look as, that we're doing that good, you know, it just.
Yep.
And Mr. Chair and Commissioner Gross, the state, so they understand that there's quite the dilemma about those going over to the Fargo side, and there may even be a delay of some of the information even beyond the pharmacies and the Fargo VA. So they're pretty confident we're close to the Minnesota percentage. It's just we can't accurately reflect that because it's not accurate information that we're receiving.
Thank you.
Okay, Commissioner Ebinger.
If I could just add to that, I have personal knowledge of a couple of people. I helped one of them register who work in healthcare on that side of the river. And in order to get through the system, and this was early in the process, the address that they used was that of their employer. So I'm sure those immunizations are showing to be residents of Cass County, North Dakota, when they're actually residents of Clay County, Minnesota. And that would elevate, and they're doing a good job over there, but that would elevate their numbers a fair amount, and they wouldn't be reflected in our numbers. So there's probably a balance in there somewhere.
And Commissioner Ebinger and Mr. Chair, that's correct, because we know of people that use their work address, but they're actually residents both in all the healthcare systems. So the numbers are certainly inflated on that side and don't reflect it on the Minnesota side or Clay County.
Does that conclude your?
Concludes
Might
our
wanna-
report.
You might want to stay here for a minute, because we have, this is National Nurses Week, and we have a proclamation we'd like to read. And I think we'll start with Steve, and we're going to go around and read this proclamation on behalf of all of your hardworking nurses.
Whereas nurses are not only the cornerstone of patient care, but are also leaders in improving the quality of care and seeking ways to continue increasing access to care. And
whereas the depth and breadth of the nursing profession meet the different and emerging healthcare needs of the American population in a wide range of settings. And
Whereas a healthy nation relies on increasing delivery of primary and preventative health care. And
Whereas a renewed emphasis on primary and preventative health care require better utilization of our nation's nursing resources. Professional nursing has been demonstrated to be an indispensable component of the safety and quality of care of all patients. And
Whereas nurses connect individual, team, and organizational safety goals in all healthcare settings. The demand for nursing services is greater than ever because of the aging of the American population, the continuing expansion of life-sustaining technologies, and the growth of home healthcare services.
Whereas the nurses deserve special recognition for the tremendous job they do, especially during the past year with COVID-19 pandemic and difficult circumstances and the risks they faced. And now therefore, in honor of professional nurses, we hereby declare the week of May 2nd through May 8th, 2021 as National Nurses Week in Clay County. And I would entertain a motion to approve that proclamation.
I'll move, Mr. Chair.
second.
I have a motion by Commissioner Moser, second by Commissioner Ebinger. Any discussion?
Thank you, Mr. Chair.
A job well done.
Thank you on
Right.
behalf of all the nurses. Thank you very much. That was quite a surprise.
Okay, all in favor signify by saying aye.
Aye.
Opposed? Very good. Please send our thank you to all of your,
Thank you very much.
Thanks, yeah, appreciate it.
all right.